And welcome to another Mark Bishop Show. Well, that Medicare annual enrollment period's here again, the deadline. By gee, it seems to come around quickly. It's approaching. Well, December 7th is the deadline. So to find out how veterans can maximize their health benefits, I invited Ed Sandrick, who's the director of the Veterans Channel at Humana, and a retired colonel with the U.S. Marine Corps, along with JJ Montanaro, Military Advocacy Relationship Director of USAA. Welcome, gentlemen, and thank you for your service.
Hi, Mark. Thank you for having us.
Yep, appreciate it.
Well, millions of Medicare-eligible individuals, including adults, 65 and older, and those living with disabilities have an important decision to make by, December 7th again, which marks the Medicare Advantage and Prescription Drug Plan annual enrollment period. Ed, I've got to ask you firstly, what's different this year to any other year, my friend?
Well, there could be many things different. One thing that is the same is the annual election period, as you mentioned, did begin on October 15th and ends on December 7th. I think what's different is what individuals need to understand relative to the plans that are available in 2022. So it's important for individuals to go to Medicare.gov to see what what plans are available through Medicare.gov or Humana.com/Medicare to see what Humana has to offer across the country. Plans change from year to year. Your situation financially and medically can change from year to year. So there is, quote, a lot going on, and it's just important for individuals to understand that, but also understand that they've got options and they've got time to make good decisions. Get some good guidance by talking with a licensed agent, again, through Medicare.gov or Humana.com/Medicare.
Right. Well, we know that researching plan options, it can be a time-consuming process for people with Medicare, especially our nation's veterans, who may have an option to select a Medicare Advantage plan that can complement their Veterans Affairs benefits, correct?
Yes, sir. In fact, there are many myths and misconceptions out there about Medicare Advantage or Medicare and VA healthcare. An individual a veteran who uses or is eligible and uses the VA for healthcare can also enroll in Medicare Advantage, and the two can work side by side. I can use my VA healthcare benefits if and when I choose to, and I can also use my Medicare Advantage plan when I want to. The advantage there is that the Medicare Advantage plan does provide options, additional providers in hospitals, easy access in many cases to urgent care, robust additional dental benefits, and a drug plan if they choose a plan with drugs. The Humana Honor Medicare Advantage plan was designed with veterans in mind. So to the veterans who use the VA is how we designed the Honor Medicare Advantage plan, which is available to all veterans and anyone eligible for Medicare. And is also, I'm proud to say that all of the Humana plans are recommended by USAA. So it's wonderful to have USAA as a partner.
Yeah, we're going to talk to JJ in just a sec. I got a buddy who serves in one of the vet clubs, and he was telling me it's a very stressful time of year. The beer sales go up, In addition to researching affordable health benefits, veterans, they have to be aware of other key considerations, such as how Medicare Advantage works with VA benefits to ensure that they're maximizing their health and wellness coverage. They don't want to miss out, do they, Ed?
No, exactly. As I mentioned, the Medicare Advantage plans can round out the care that an individual gets through the VA. So they can have both. They can go to the VA if and when they want to, or they can use their Medicare Advantage plan. And the Honor plan is available. It's at a zero premium, so there's no monthly premium. It has expanded urgent care, as I mentioned, as well as a Part B give back. So individuals who enroll in the Honor plan can get money back in their pocket. And again, it's available to anyone who's eligible for Medicare.
Well, you've touched on the fact that Medicare Advantage and VA benefits work together, so there's no issues there. What should eligible beneficiaries, including veterans naturally, know about selecting a Medicare Advantage plan for this coming year? Is there anything that stands out?
I do think that they need to understand that things can change. So this is the time when Medicare Advantage plans may have changed from the plans that were offered last year. So it's important for them to get all the information available. going to Medicare.gov to see what's available in their area, or Humana.com/Medicare to see what plans are available. Individuals' health needs change, their financial situation changes, so cost is definitely a consideration as well. It's just important to get good advice, and through Humana.com/Medicare, an individual can also talk with a licensed agent to make sure that they're making the right selection for 2022.
Mm-hmm. Well, JJ, your turn. You're not going to get away with this totally. I know you're tired and all the rest of it, but for people...
I had one foot out the door.
Well, I lassoed you back in, right? So, for those that don't know a lot about USAA, and I don't know why we see enough ads, tell us a little about the company and your connection to the military from a, let's say a financial planning perspective.
Sure. Well, our connection to the military community really runs back to the nearly 100 years ago. Actually, next year we'll celebrate our 100th anniversary when we were founded by 25 Army officers. We offer insurance, banking, investment and retirement products and services, and right now to our 13 million members. But who are those folks? Well, they're those that are currently serving. They're those that honorably served, and of course their families. And to your point, it doesn't include Gronk. Apparently, we're running that commercial hard. So we're focused on that set of people, their financial security, and that's why we thought it's really important to have the conversation we're having today, Mark.
Mm-hmm. So why is USAA working with Humana then as part of their Medicare work?
Right. Well, essentially, we've got with Humana and USAA, two companies that have a similar set of values, two companies that are focused on serving the military community. And so there are 9 million veterans that are eligible for Medicare. And so this is an opportunity for us to work with Humana to serve those folks and to help them address the fairly daunting and fairly complex issues that Ed talked about when it comes to this annual enrollment period.
Okay, well, we're coming up to close. Ed, I'd like to ask you this. Can you tell us a little bit more about the Humana Honor Plans and how to know if it is a plan that you should consider?
Sure. Well, a couple of years ago, we developed the Humana Honor Medicare Advantage Plan with veterans in mind, particularly the veterans who use the VA. And it was designed to complement the care that a veteran may get at the VA. It is available to anyone eligible for Medicare, but again, it was designed for the veteran who uses the VA in mind. The advantage there is that I can use the VA or enroll in a Humana plan at a zero premium. I can have access to additional doctors and hospitals, more readily accessible urgent care, a robust dental plan, and actually get money back through Part B give back. But again, the most important thing I think for any individual, in particular veterans, is to go to Medicare.gov or Humana.com/Medicare and talk with a licensed agent so they can understand. You can tell them all of your specific needs, whether it's financial or medical, and they can help you enroll in the plan that really fits for you.
So what you're saying is, Ed, if they go to these sites, either of them, they can actually talk to somebody virtually immediately. Is that right?
Certainly through Humana.com/Medicare. They can actually talk to a licensed agent on the phone, or perhaps if the situation permits, particularly with COVID, to do things safely, they can talk with an individual agent in their area in person.
Mm-hmm. Yeah, with a mask on, of course. And, it's people like to do that, don't they? It's coming back slowly. Well, but they're important, those sites. There's a lot of information on them, and it's a good place to start. www.medicare.gov, okay, and the big one, humana.com/Medicare. So that's www.humana.com/Medicare. All right. Well, gentlemen, thank you. You've had a busy day so far. I know that you're getting your message out all around the nation, and I thank you for taking some time with me, and good luck with your road trip, okay?
Thank you very much, Mark.
Time, Mark.
All right.
Take
Goodbye
care.
now.